I'm Dr. Chris Pagnani, the Medical Director of Rittenhouse Psychiatric Associates with physical locations in Philadelphia, Pennsylvania and Paoli, Pennsylvania. We also have providers serving individuals living in many different states, including Pennsylvania and New Jersey, but also New York, Florida, and I'm personally licensed in Maryland, Delaware, California, and a few other states as well. Virtual visits are something that we started a couple of years back, and they definitely can have their advantages. We're seeing a lot of individuals who live hours and hours away from our practices who said that they had difficulty finding a provider that they felt met their needs locally. Individuals will also say that if they have a busy work schedule or home life or school schedule, it's pretty convenient to just step into a quiet place or go out to their car and take an appointment for 20 or 30 minutes with one of our providers. With that being said, there actually are some disadvantages to telehealth psychiatric visits. For example, with some of the medications that psychiatrists and psychiatric nurse practitioners utilize, we may want to check vital signs, and it's rather impossible for us to do that when we're talking across the screen. And so if you set up a virtual visit with one of our providers, it's incredibly important that if we ask you to go to an emergency room or go to an urgent care or see your primary care provider, that you do so. There are also specific guidelines that need to be followed. So the providers that you see, they must be licensed in the state that not only they are sitting in, but also in the state that you're sitting in. So if you go to our front or home page for Rittenhouse Psychiatric Associates at rittenhousepa.com, you can use our search tool to see which providers among psychiatrists, psychiatric nurse practitioners, and psychotherapists are licensed in the state where you live. Additionally, insurance companies may or may not reimburse for virtual visits. Typically, there's a modifier that providers use when giving you an invoice for your visits. It's usually a virtual or -95 modifier. You're going to want to call your insurance company before making an appointment and ask whether they provide out-of-network reimbursement for virtual visits. And as discussed elsewhere, we are a fee-for-service practice, and so any reimbursements that someone would get from their insurance carrier would be for out-of-network reimbursement only. If you have any questions, please do not hesitate to reach out to us directly. Amy, our office manager, will pick up the phone, 267-358-6155, extension 1.